Hi everyone, my name is Patience Munyokonde. I'm a member of Women in Infectious Diseases and Health Research in Malawi, WIDREM. I'm a young researcher who's passionate about women's health. I aim to advance women's health, specifically in the area of cervical cancer, in my country and beyond. My research focuses on human papillomavirus, which is the cause of cervical cancer. Therefore, the title of the study I am presenting to you today is Factors Contributing to Missed Opportunities for Human Papillomavirus Vaccination Among Young Adolescent Girls in Doa, Malawi. Cervical cancer is the fourth common type of cancer which affects women globally. As of 2022, World Health Organization recorded about 660,000 new cases of cervical cancer. Malawi, which is a very small, low-middle income country within Africa, is also not spared from this burden of cervical cancer. The incidence and mortality rates within this country are 75.9 and 49.8 among 100,000 women respectively. However, there is hope because there's a vaccine. And this vaccine is an effective strategy to prevent cervical cancer. Despite the vaccine being rolled out within Malawi in 2019, national coverage, which is 33%, remains relatively low. And this is attributed due to missed opportunities for human papillomavirus vaccination. But what is a missed opportunity? A missed opportunity is an occasion whereby a young adolescent girl misses the opportunity to be vaccinated despite being eligible due to no known prior contraindication. Therefore, the main objective of this study was to identify the underlying factors that contribute to missed opportunities for human papillomavirus vaccination among young adolescent girls, specifically those of 9 to 14 years old in Doa, Malawi. A descriptive cross-sectional study was deployed. Girls aged 9 to 14, as well as their guardians, were consecutively sampled from households within Jankungu in Doa. Additionally, key informants from the schools, the district, as well as the health facility were also purposefully selected from the same Jankungu in Doa. A semi-structured questionnaire was used to collect data, and afterwards, the data was analyzed using Stata version 14. Descriptive statistics were computed, including frequencies for categorical variables, as well as means for continuous variables. .691 study participants met the inclusion criteria. Of this, 354 were girls, 296 were guardians, and 41 were key informants. Figure 1 below shows factors contributing to missed opportunities at all levels, including the household, the schools, the district, as well as health facilities, guided by the key below. So we'll start with the household. As we can see on the household, the most reported factor was cultural religious beliefs, while the least reported factor was misinformation or vaccine hesitancy. Contrarily, at schools, we can see that the most reported factor was misinformation or vaccine hesitancy, while the least reported factors were cultural religious beliefs as well as accessibility challenges. At the district, we can see that cultural religious beliefs were also the most reported factor, while the least reported factor were accessibility challenges. And lastly, at the health facility, the most reported factor was myths and misconceptions, while the least reported was lack of awareness. So on overall, we can say that the factors that contribute to missed opportunities at all levels were cultural religious beliefs, which attributed to 28.9%. This was seconded by lack of awareness, attributed to 23.9%. Then, misinformation and vaccine hesitancy. While the least reported factor contributed to missed opportunities for HPV vaccination was myths and misconceptions, attributed to 13.5%. Our study found out that the factors which contribute to missed opportunities for human papillomavirus vaccination at all levels, including the schools, the household, the district, as well as the health facility, were primarily influenced by culture or religious beliefs, as well as lack of information or misinformation. This suggests that there is a need to raise awareness through culturally appropriate messages in order to improve the delivery of HPV vaccine. Our future research is to develop an integration model that addresses all these factors contributed to missed opportunities for HPV vaccination. Listed here are the references for your review. Coming this far, I would like to thank our sponsors as well as partners, which include Alliance for Health Policy and Systems Research, World Health Organization, Gavi, Blanda Institute for Community Outreach, BICO, Ministry of Health, as well as Women in Infectious Diseases and Health Research in Malawi, WIDREM. This far, ladies and gentlemen, I truly appreciate for paying attention.